Hello, everyone. My name is Jean Lewis, and today I'll be presenting on eating disorders as a public health issue. Specifically, I'll be discussing how the socio-ecological model and interdisciplinary approaches can help reduce the burden of eating disorders at the population level. First, we need to understand eating disorders. We know that eating disorders are a public health issue. It affects physical, mental health, influenced by multiple factors, not just individual behavior. Eating disorders are serious mental, physical health conditions that affect individuals across all age groups, but especially adolescents and young adults. While many people think of eating disorders are personal and behavioral issues, they are actually influenced by multiple factors, including social, environmental, and structural conditions. And why this matters. We've seen rising cases in adolescents, long term health complications, high mortality risk, impacts our communities, not just individuals. Eating disorders are increasing, particularly among younger populations. These conditions can lead to severe health complications such as heart problem, malnutrition, and even death. According to the World Health Organization, eating disorders are among the most serious mental health conditions in terms of mortality risk. Now, the key question becomes how do we reduce the burden of eating disorders at the population level? To answer this, we need to move beyond individual level thinking and consider broader influences. We need to look at the social ecological model. The social ecological model helps us understand health by looking at multiple levels of influence: individual, interpersonal, community, and societal. Each level plays a role in shaping behaviors and health outcomes. At the individual level, we've seen body image issues, low self esteem, coping behaviors, mental health factors. Eating disorders are influenced by factors such as body dissatisfaction and unhealthy coping mechanism. Psychological research shows that individuals with negative body image are more likely to develop disordered eating behaviors. At the interpersonal level, relationships matter. Family attitudes about food and weight, peer pressure, and social media all influence how individuals see themselves. Social comparison plays a major role here, especially among adolescents. At the community level, school education, access to healthcare, lack of access to healthcare, food environment, community resources, all influence behavior. For example, access to mental health services and nutrition education can either reduce or increase risk. Communities that lack resources often see worse outcomes. At the societal level, broader influence such as media, health policies, and economic systems shape behavior. Media often promotes unrealistic body standards, while economic inequality affects access to healthcare and healthy food options. Now, let's look at the interdisciplinary approach. The interdisciplinary approach requires multiple discipline to working together. Psy- Psychology, I'm sorry about that. Psychology helps us understand behavior. Sociology explains social influences. Nutrition focuses on diet. Public health develops prevention strategies. And policies addresses structural barriers. So now let's take a look at the real world insight. Food environments influence behavior and not just individual choice. This means we need to look at system, not just people, when addressing health issues. And one of the biggest challenges in that and is that public health often focuses too much on individual responsibilities. While behavior matters, ignoring environmental and structural factors limits the effectiveness of intervention. What is the solution? So to improve outcomes, we need multi-level solution, multi-level interventions. We need to look at community programs, early education, policy changes. And it's, it includes education at the individual level, support system at the impersonal level, community programs, and policy changes at the societal level. Why it works? This approach works because it addresses the root causes instead of just telling people to change behavior. It creates environment that support healthier choices and reduces barriers. In conclusion, eating disorders are complex public health issues that require comprehensive solutions. By using the socio-ecological model and integrating multiple disciplines, we can develop more effective strategies to improve health outcomes. Prevention rather than reaction should be the focus of public health efforts. And the sources used in this presentation include the CDC, WHO, and peer-reviewed research studies. Thank you.